Mm, Recording has started. Actually, my friends told to upload the classes of Materia Medica. That is why. So sorry. So we are saying about Hepar sulph. We saw its common name and also the preparation, how it has to be prepared, a combination of sulfur and calcium. We saw why it is called as liver of sulfur because of that yellow color and the sphere of action and how it is connected to the current, our homeopathic therapeutic. And now going towards the similarity. So Hepar is a good, very good medicine which acts on skin complaints. Skin complaints and throat complaints are the most important complaint in which we give Hepar. Also, asthma is the so sulfur, you know that it is also having a predilection on skin. So that is where the similarity of Hepar and sulfur come. Both are having action on skin, producing eruptions. Pustula eruptions means pus will be coming or forming abscess, and it is very sensitive to touch. And with calcarea, it is the chilly nature that is coming up. Sulfur is actually a hot patient, and calcarea carb is actually a very typical chilly patient. And when its combination come, Hepar sulph, it is not, it is amphithermal. No, Hepar is actually very chilly like calcarea carb. So even in calcarea, there is sensitive to cold air. We can see the same sensitiveness for Hepar also to cold air, and they always wants to wrap up even in warm weather. And this is something that we see in drugs like Silesia and also Berita cup. So ailments from cold, dry winds, as we told, because it is highly sensitive to cold climate. So anything that is chill or going to a chill room, a cold room, cold atmosphere, it is going to bring about complaints for them. However, there is a change like causticum also. They are actually having an amelioration in a damp weather. We'll see that. Anyway, from cold, dry winds, they have the complaints. From also injuries, because all the injuries can tend to separate. We have other medicines in that category, Merxol, Sorinum, etc. So all the injuries that happens, every injury on the skin, it can end with suppuration. Then mercury, I told you, whenever the mercury has been abused, it can result. Oh, so whenever mercury has been too much prescribed or abuse of mercury has happened, we can think about Hepar sulph. Suppressed eruptions. Suppressed eruptions means we already saw that there are skin eruptions that is possible. And if any eruptions have been suppressed, especially using mercury, and it had resulted in some other symptoms, the rheumatism or other internal symptoms, we can think about Hepar sulph. Then mental or physical exertions. So the constitution is almost similar to that of a calcarea cup because we can see a torpid lymphatic constitution. Even in calcarea cup, we see that there is a lymphatic constitution. People are very fat, flabby, and all. Here we can't say they are that much fair, but yeah, of course they are having a light complexion, light hair, not as beautiful as attractive as calcarea cup, but still they are having a light hair and complexion, and they are very lymphatic, torpid, which means slow to act. The muscles are all soft, flabby, etc. So, so whatever we see in Calcarea cup, the same constitution almost. They're chilly patients, and like sulfur, Hepar is also adapted to the psoric scrofulous diathesis. Scrofulous, you should be knowing that it affects all the glands which is in the throat region, especially the um, tonsils, adenoids, etc. And in mind, the most important feature in mind, though I kept it as four, the headlining will be they're extremely sensitive. When we say Hepar sulph, the first alphabet, Hepar, H itself is stands for uh, one of the synonym for this or the characteristic symptom, that is hypersensitivity. So this sensitivity we can see in both mental and physical level. They are very sensitive to all the physical, um, s- uh, uh, s- uh, things like noise, odor, um, and even the cold air, pain. So all the external impressions they are highly sensitive, and also they are sensitive mentally. So even the slightest thing that they are going to get so irritable and so anger, and it is not that they just get anger, they are vehement actually. It's not just a irritability or a or anger that we see in nux swarm. This goes a bit high grade, like the person is easily angered, abusive, can hit or stab his friend. So that much highly aggressive those persons are. They're very ferocious. And another important feature of Hepar self is when we say hypersensitive, H, hypersensitive, another important feature will be hasty speech. Even they have hasty drinking and also eating. So everything they do in much hastiness. So from the HEPA self, the starting edge, we make some symptoms. One is hypersensitivity. The second one is hasty speech. And third one is hasty eating and drinking. So the very angry person and extremely violent that they have a sudden impulse to kill. Mother has an intense desire to throw the child in the fire. So they are extremely to the level of destroying or killing someone. And this much anger and all we don't see in Nux vomica. And obviously, when we are going to prescribe this medicine in a acute condition, because we prescribe Hepar quite commonly for acute complaints. Whenever the person is coming with a quinsy or tonsillitis, if the symptoms match, Hepar is a very good remedy to act. So we give that complaint Hepar, and then another one is cough when there is a loose mucus or rattling cough. When we feel like there is a lot of uh, expectation that has been accumulated in the chest, then we can think about HEPA it really acts. And then for the skin complaints, these are the things that we acute for complaints which we commonly prescribe HEPA. This is one of the medicine we prescribe commonly also. But at that time we may not get other symptoms like the person is having a tendency to kill someone. No, they may, what we get at acute complaints will be the person will be extremely irritable, that chilly, extreme sensitivity to chilliness, and the external impressions like noise, and all that person, or the smell, the person is not able to adjust with that, making him irritable, that we'll get, but not this deeper pathology that when we get, it will be more towards the constitutional prescription. And then only I told whatever we get the constitutional symptoms, we can think about it. The person does not wish to see the members of own family. While walking in open air, the patient feels discouraged and is annoyed by the recollection of all the past unpleasant things that have happened in his previous life. Previous life means what happened before to his life. So just remember these symptoms, that is hypersensitive both in physical and mental level, highly irritable person, getting angry so soon, and even with violence that they want to stab the friend, or any family also. Hasty speech, and then sudden impulse to kill, where the mother has an intense desire to throw the child in the fire. Even this similarity we can see in other drug like sepia also, your mother, because of indifference. That is because of indifference. But here it will be more towards an anger, vehemence, etc. Then there might be sadness, not that characteristic importance, with some thoughts of suicide, but not that important. Then in the general features or the guiding symptoms, we have hypersensitivity in physical plane. So to touch, noise, odor, pain, cold air, they're highly sensitive. The touch is highly characteristic. So we told that the patient is will be having some skin affections. Every injury, there is a tendency for it to separate or abscess to form. or not a big abscess, even small boils may be form of carbuncles, and it will be extremely sensitive that even the touch of the cloth will be causing him much painful. So that much hypersensitive he is to touch. It's not just external touch we are touching, that is the might be the, but here the hypersensitivity to touch indicates even the cloth, even the cloth sticking onto that eruptions is going to cause much painful for him. And that pain, it is highly characteristic that they explain that the patient can faint with pain. If the pain is extreme, the patient can even faint with pain. That's the explanation how they give. Even the thought of pain or injury makes them cringe or shiver. That much sensitive they are. So when a patient comes to you, it's always told that they will be having throat complaints, but the sensitivity the patient shows or his way of explaining that pain or the tenderness he you observe, if it is out of proportion to the appearance of the throat, we can think about Hepar because that is showing his hypersensitive nature. And that pain will be pricking, sticking, or splinter like. This feature we'll see later. It is highly characteristic. You might have learned in another drug like argin and nitricum, which is another more important. Other drugs, I don't think you have studied it. It is tolicose and nitric acid. Where the patient is having a sensation that something fish-borne or some splinter, it has been struck in the throat region. So they have such a sensation. A pain is perceived as pricking, sticking, or splinter-like. And this can be actually like anywhere. If they are having some rheumatic pain, or if it is the pain that is associated with skin complaint abscess, then also they have this sticking, pricking pain. But this splendor sensation or something fishbone is struck over there, we can see more often in Hepar sulph. If there are inflammation, and there's a good remedy for inflammation also, or swelling in any locality or any eruption on the skin, they're sensitive that they cannot bear even to touch or even have the cold air to blow upon them. And somewhere in further, we will see that they have a sensation that air is passing through them or air is blowing through them. And that shows their hypersensitivity to chilliness. So in inflammation, Hepar sulph is useful when pus is about to form. So if you remember when I was taking your class for belladonna, I told you the sequence when the medicine is given for inflammation. And that will be always aconite, belladonna, Hepar sulph, and then uh, aconite, belladonna, Hepar sulph, mercurius, and then silesia. However, we shouldn't give mercurius and silesia together. So the order will be exactly aconite, belladonna, merc, Hepar sulph, and silesia. It's always better to give because of the same nature, the antidotal nature of the mercurius. It's better that Hepar sulph come in between mercurius and silesia. So that's the order in which we give. So in the initial inflammation, when it is more reddish and uh, uh, when the inflammation is just about to start, it is always aconite. And when it is reddish, high temperature with that violent paroxysmal nature or whatever, then we can think about belladonna. But in both these stages, the pus has not formed. But once the pus has formed, the medicines will be more towards the mercurius, Hepar, and silesia. So Hepar sulph is useful in inflammation, especially after the stage when pus has formed or is about to form. If given very high in the first case, that is before pus is formed, and not repeated too soon or often, we may prevent suppuration and check the whole inflammatory process. Uh, Though we can see such sentence in Boric and also Alan Skinot, there is a catch over there. But before I say you, I will explain you. So, as we say that Hepar sulph should be indicated in those conditions of inflammation when pus is about to form. And if ever you have had a boil in your body, you would be knowing that boil is always painful, yes, but it is when it is becoming a little bit fluctuant, like we know that the pus is about to form, it is becoming soft, then naturally or medically even the pain of that boil is going to increase. So before that also we might have be having that pain, but it will be intensified when the pus is about to form. And then somehow as the pus is getting accumulated, it is going to be too painful, and then we somehow wants to either it break off it by on, or we do a C&D and make the pus to come out. So at that time, medically also it is also already explained that the pain will be too sensitive, I mean too intensive. So that is why Hepar sulph is also indicated. Hepar sulph do have a nature that it can change any skin injury to suppuration, or when any skin injury develops to suppuration, Hepar sulph is indicated. But more so, we can connect the same feature because of that pain, the pain that is being arised due when the pus is formed. So if we are going to give Hepar sulph initially, that is initial stage of inflammation when the pus has not formed, that is when aconite or belladonna should have indicated, and by mistake or something we gave Hepar sulph at that time. It is told, and at that time if you are giving, it has to be given in single dose and also high potency. So if it is given in very high, that is high potency, and not repeated too soon. So single dose, 1 m single dose, if you give, it is told that it will never go into the stage of suppuration, and we can check the whole inflammatory process. Though we see this statement in Boric and also Can, and not Can, sorry, Alan Skinnott, I saw an anecdote which was given by J.H. Clark in his Materia Medica, in which he saw that one of his fellow colleague who had given this medicine, Hepar sulph, in CM potency, okay, not even 1 m potency, but in CM potency, Hepar sulph was given just one dose in the earliest stage, but still it ended with abscess, and not just abscess that it went into complication or something. No, the pus came out and then it was completely cured. So we really don't know whether it will happen so or not, but because even I have never tried. Whenever we see that it is a boil, medically also it is very ideal that let the pus come out. Even I think even allopaths also, maybe they give some antibiotic to prevent further infection, but they also promote this C&D, so that whatever that pus is formed will just make it ooze out. So this is an told that if it is given in hypotency in single dose in the initial stage before pus is formed, we can arrest the whole inflammatory process. But if pus is already formed, then it is going to hasten that discharge point and the pus is going to come out. So when a patient is coming to you with that softness, we can feel that uh, fluctuation nature of that boil, and you're sure that the pus has formed it. And it is not, sometimes patients comes like that. The patient, it is forming, and we know that it's just that point has to be formed and the pus is going to discharge by its own. But for some patients, the pain will remain as such, but it doesn't break open. So in those conditions, it is told that if we give Hepar sulph in lower potency and frequently, Hepar sulph in lower potency and frequently, then the pus will be discharging out. So remember this feature. If to abort the condition, it is high potency single dose, and if it is the pus that is formed and to help its discharge, then it is low potency like Hepar sulph 30 and frequent repetition in pills, 3 pills 3 times, then very soon it will be breaking open. That's what it is told. So this one, the second thing I have tried, and yes, it works. The first one, that to about the inflammation, I have never tried that, so I don't know about it. But the latter one, it does happen. This lower potency frequently given, the separation happens very soon. Extremely chilly patients, we saw that they hate draft and dislike being touched. So remedies that is aggravated in cold air are arsenicum album, I just put it there, calcarea carb, Hepar sulph, nux vomica, sorinum, silesia, tuberculinum, and we can put another remedy also. I mean, there are a lot of remedies. Okay? Even the Cali group is there. Right, carb, and just put calcarea carb, calcarea, sorry, Cali group. Cali group, one of the medicine, calibrom or calipi, it is hot patient actually. Uh, calibrom, I think. It is calicarb and calibi chili patients. It's calibrom that is hot patient. So these are the most important chili patients in homeopathy. So I just classified it together. And I hope you know this Calcarea austriarum, which is not another remedy. It is Calcarea carb only. It is Calcarea carb is having the second name Calcarea austriarum because it is taken from the oyster shell. So this name is also given Calcarea or austriarum. Never confuse whether this is the same remedy or another remedy. It is another synonym for Calcarea carb. Then all the injuries, cuts, wounds, etc., it heal very slowly and mostly it has got a general tendency to separate. Pus will be very offensive and a character has been given like carrion like odor. Carrion will be spoiled meat or rotten meat. So that will be the odor they have. Even Merxol, Sorinum, etc. Uh, also they have the feature, all the separations or the pus that is having a carrion like odor. So other remedies which have this slight injuries or scratches on the skin which separate, we have medicines like graphitis, mercurius, and petroleum. And graphitis and petroleum, I don't know whether you remember when we discussed in the last semester action on the integumentary system. We had discussed at that time graphitis and petroleum. We have compared and contrasted only the difference which will come in the nature of their discharge. So we have discussed over there, even for them, slightest injury will separate. So these are the four important remedies which have this common feature, even the slight injury can result in separation. Then this is a good remedy for all the croupy conditions where there is an inflammation of the upper respiratory tract. So all the structures, larynx, vocal cord, trachea, etc., it will be inflamed and the air tract will be reduced. It's uh, the width of the air tract that will be reduced because of the inflammation. Then infection or the perspiration, it smells sour or like old cheese. This is a very important symptom to remember. More than infection, okay, just leave that word. Infection or the pus coming from the, remember the carrion like odor. And for this one, perspiration will be enough. Perspiration will be having a sour smell or the like that of an old cheese. It's totally a offensive nature. So somewhat similarity we can see mercurius. I don't know whether you have studied mercurius. Mercurius is also having this offensive nature. Then they have very craving, very characteristic craving. It's very important to remember because it's a general feature. They have craving for pungent food. Pungent means highly spicy type of food and fat and also sour flavors like vinegar. So already they have this sour smell over their whole body. Now when we go towards the GIT proper, we see that they have got diarrhea and the stool will be having a sour smell. And they are liking sour flavors like vinegar. So their desires, their complaints, everything is sour in nature. Oh, we can smell that sourness. It's a great sweat remedy, sweats day and night without relief. And that sweat is having the sour smell or the smell like old cheese, which is very offensive. And the same symptom, the sweat day and night, but without any relief, we can see in Merxol. And there are two other drugs, that is natrium ureticum and sorinum, which is actually having profuse sweating or perspiration. But natamure and sorinum, they will be having amelioration during sweating. But in case of moxol and hepar, there is increased sweating, but sweating doesn't give any amelioration. They don't feel any relief from sweating. And the opposite will be natamure and sorinum. Then we move towards particulars. So as I told, it is the respiratory GIT skin that is more important. So we'll start with the respiratory. We'll start with the simple catara or chronic catara. Uh, though I'm a chronic catara, I could say you even a acute nature. So if the person is having this tendency to catch cold very easily, and whenever he goes out, like the sentence is like this: whenever the patient goes out into the cold air, his nose is getting stopped up, that much chilly. So that is why the chronic catara, we can give this medicine. All right, it doesn't mean that acute complaint we can't give. It's not like that. It has become like every time he go out, he is catching cold. So that has become a part and parcel of his life. So that's why they mention it as chronic catara, not that acute came and it stayed for a long time. Then it became subacute, and then after 2 to 3 weeks, it go into chronic stage, dry stage. No, not like that. These persons, they have a tendency to develop catara so frequently that we can almost call it people with chronic catarrhal complaints. So the patient says, it seems as if I get a new cold every time I get a breath of fresh air. And this is a statement same told by tuberculina. So tuberculum is another remedy, and this can be asked as a MCQ. Cold every time when the person takes a fresh breath, like even a fresh air the person is taking. The first sentence we can of course say, like we saw that Hepar is a chilly patient, extremely chilly. So that when they are going to cold air, they're going to get developed catara. Yes, but in case of tuberculinum, how it get differs is they don't have to be in cold, even if it is a fresh breath or fresh air. Tuberculum is so sensitive, their coldness or this catarrhal nature will be coming out. So even that feature we can see in Hepar. So from Kotara, the second complaint we will discuss will be its croup. So Hepar croup is accompanied with loose cough and also wheezing or rattling. Cough as if mucus would come up, but it does not, like that of antimptot. It is seldom indicated at first, but often comes in after two aconite. So usually in the croup conditions, in the initial stage, I mean croup also because it is the inflammation of the upper respiratory tract. Inflammation means we saw the order. So aconite will be the first one to indicate, but towards the later stage of croup, when the mucus have accumulated and we feel that the patient is going to cough up a lot of mucus, it won't. But there are conditions, especially in the asthmatic conditions, when the patient can raise up a lot of expectoration also. It is not that it won't come up like antimptot, it will, but both the natures we can find. We have to then compare what are the other features present to either give antimptot or Hepar. So Hepar, there is loose cough, wheezing, rattling, cough as if mucus would come up, but it does not. It is seldom indicated at first stage, it's always in the later stage. And what makes it different from aconite is, even in aconite, the croup or this throat complaints, it comes up by exposure to dry cold air. And same is the causation that we have seen in Hepar sulph also, sensitive to that cold, dry air. So when they are exposed to that cold, dry air, like aconite, even Hepar sulph can develop this throat complaint. However, see the timing, the aconite croup or that croupy nature, that cough, it usually comes in evening after to first sleep. So before midnight or around that midnight period. And if we remember aconite's general modalities, we can see that aconite is having a general aggravation in evening towards midnight. That's how we learn about aconite also. So here in aconite, it comes evening or towards midnight after the first sleep. But in Hepar, it is always the early morning hours. So that timing it's changing. So in case of croup or catara, the chronic catarrhal conditions, the breathing will become very difficult, rattling, anxious, etc., even to threaten suffocation, so that the patient may develop into asthma. So the croup, what exactly happens is the respiratory tract, the upper respiratory tract is getting inflamed, and because of this inflammation, the swollen tissue, the narrow pathway, the air tract, it will get narrowed. So the air flow will be impeded. As a result, the patient may develop asthma. And asthma, Hepasulf is a very good remedy in asthma, the chronic asthma, which means even an acute exacerbation of chronic asthma. We can think about Hepasulf. So in chronic asthma, Hepar often resembles natrum sulfuricum. So natrum sulph is a very good remedy for GI complaints, dysentery, and also for cough, the chest complaints, the pneumonia, all those things. Natron sulph is a very good remedy, and natron sulph also, because it is told as hydrogenoid constitution of gravocol. I don't know whether you remember, but we have discussed this in maybe last semester. Natron sulph, it is called as an hydrogenoid constitution, and this hydrogenoid, carbonate, nitrogenoid, oxygenoid constitutions. These are some constitutions which were told by a scientist or a material medical person. I don't know, Gravagol. He's not typical homeopath, but I don't know. He had mentioned this constitution. So according to him, this hydrogenoid constitution is more similar to that of our psychotic constitution. So the person will be very having hydrogenoid, which shows the presence of, or not presence of, yeah, presence also of excess fluid in the blood, in the body. So the person may be edematous or appearing fat, chubby, etc. by constitution. And also these persons will be having complaints from excess exposure to water related elements, like they won't be able to live in a area where there is much accumulation of water near to water bodies, river. Even plants or animals grown in water, they can't assimilate easily. So that is called as a hydrogenoid constitution. The slightest exposure to water or water related organisms as a food, they are going to develop complaints. So Hepar doesn't have this hydrogenoid constitution. They don't have this. They're sensitive to cold air, yes, but not that they can't live near to a water body, nothing like that. But natrum sulfate, it's a hydrogenoid constitution. So in chronic asthma, we can see that Hepar and natrum sulf are very much related. There is no other remedy, but there is some difference, and that's the uh, modalities we see. There is no other remedy that has amelioration so strongly in damp weather as Hepar. So this is a characteristic feature. We always say Hepar is chilly patient. They don't want to be uncovered. They always wants to get covered, even in the summer season. But the thing is, they are having complaints, especially from dry, cold air. If it is dry, but if it is damp, they are having much amelioration. So that is the main difference. The Hepar asthma is worse in dry, cold air, but better in a damp weather. While that of natrum sulph, it is exactly opposite, like they are affected with that moist cold or that wet weather, and it is similar in that manner to Dulcamara. Similar means natrum sulph and Dulcamara will go together. That is the chest complaints or pneumonia or any lung affections where there is asthma, especially due to exposure from wet cold air. And if it is dry cold air but amelioration from damp weather, Hepar is one of the best remedy. And it is even told that there is no other remedy that has the amelioration so strongly in damp weather as Hepar. So why this sentence become important is Hepar is so chilly, we already mentioned, but still they have problem from dry cold air, not the damp weather. And this is an important sentence. When they have the asthma, they take a particular attitude or a particular position of the body to get amelioration. So in case of Hepar sulph, the person will be sitting up and bend the head backward like this. That will be the attitude the patient takes up in case of when the patient is having an asthmatic attack. And now in brackets, I have given some other remedy. And these remedies, I don't know, maybe ASAP you have learned, but all the other remedies, when you learn, you have to remember in asthma what are the attitudes they keep. Even we prescribe like that, we do get action. There is another one also to be added in this list. So when you study, now I'm not mentioning what are their positions because you will forget or you will mix up. But when you study these drugs, uh, remember the attitude they keep up in asthmatic complaints. So for Hepar sulph, it is sitting and bending the head backward. And ourself, I hope that you might have learned, it is sitting upright. They don't head backward. I mean, they don't bend the head backward. It is sitting upright, or they may slightly bend forward. That's all, but never backward. So that's the position of ourself, and Hepar will be sitting upright and bending backward. The other drugs, if you have not studied, I'm not going into it, their attitude, but remember this list of drugs. Then they have a characteristic feature because they are sensitive to patient cough when any part of the body becomes uncovered. We can see this symptom in Barita, Rustox, and even in Nux form. Nux form, any complaint can come about when they are getting uncovered. The sputum of the Hepar sulph, it can vary. It can be scanty, it can be tenacious. Tenacious in the sense it won't be coming out from the air tube. It will be like stick on to the air tube uh, like a what is that glue. That is tenacious, or it may be pus-like or bloody masses. Whatever it is, when we are going to, or it comes out, or if you are going to crush it, you don't have to crush it, but it will have, or it will emanate that very offensive carry-on like odor. So that is the important feature. It can be less, it can be tenacious, it can be excessive, but the nature will be very offensive like a carry-on. And we have the same order in sorinum also. When we explain the discharges of sorinum, say the same word, carry-on like order. So Hepar sulph, this we have mentioned somewhere above, being an antisoric, is suited for all the ailments, especially when there is a suppressed or retrocedent eruption in the skin. Some skin eruption, when we have suppressed it or it has gone deep interior to the internal organs, then Hepar sulph, like sorinum sulfur and many other remedies, even Hepar sulph is indicated. And that is just showing the antisoric nature. So another important sensation that in the throat is, as I mentioned above, they will be having a sticking sensation or a splinter-like or a fishbone sensation in the throat. And that is actually classified as a first grade sensation. This sensation, whenever I have got in patients, it's either hypersensitivity or I get this sensation, I have prescribed Hepar sulph. But when this sensation they say, and I had given Hepar sulph, I had seen its action. It is very good in acting in the throat region with this sensation. The patient will be extremely saying that as if some thorn, the fish bone have got stuck over there. I am not sure whether they will say the very big words like splinter and all, but of course they feel like some thorn have been struck over there. So that will be might they say. So this sticking sensation or that pricking pain, it will be felt especially on swallowing also and extending to the ear. And also it is there during yawning. Um, so this same splinter or fishbone sensation we can see in Argenta nitricum, dolichos and nitric acid. Probably Argenta nitricum you might be remembering if you have studied, but other two remedy I don't know whether you have studied. So this symptom we can always see in another condition that is quinsy. So when we have this symptom, when Hepar is indicated, it is usually for quinsy. And in case of Argenta nitricum dolichos and nitric acid, we can see this symptom. They are having this splinter or a fishbone sensation, or something sticking, but it is more of a general feature, and they don't have it, especially in the throat region or like a quinsy. They don't have such a throat nature. This for Argenta nitricum dolichos and nitric acid, it's more of general, like um, nitric acid, especially the sensation is felt in the rectal region because they have complaints of hemorrhoids. So they have a splinter like sensation of pain. Argenta nitricum is also having this sensation, but it is all throughout their body. The pain, the general pain in any part of their body, they feel like that. Dolichos, I don't much remember about Dolichos. Anyway, it is only for Hepar that is having that sensation of splinter in the quinsy. And quinsy is peritonsillar abscess. So, in chronic hypertrophy of tonsils with hardness of hearing, any complaint, the acute, finally leading into a chronic, we can think about the tonsils, the chronic hypertrophy of tonsils with hardness of hearing. Another important remedy which will come almost similar will be Berita cup. So, because in your case, we don't compare Berita cup, it's not coming in that sequence, and I won't be asking you out much probably. Usually, one question I ask. Anyway, so usually the throat complaint or the quinsy, uh, in when I used to study BHMS, we used to get a comparison of Hepar and Varitaka, how we will differentiate these two drugs. So they have much similar also in case of Baritaka. They also have highly sensitive to chilly nature and this chronic nature or the chronic hypertrophy. But one of the characteristic feature of Baritaka will be the child will be very idiotic in nature, stupid nature. That is what we see in case of Baritaka. But Hepar is not like that. They are very angry, hypersensitive, yes, even very irritable, but they are not stupid like that of Baritaka children. So that's how we usually differentiate these features. And Barata curve is also not having that offensive discharge. They will be having uh, uh, throat complaint, but not excessive rattling that is seen in Hepar. Next, for the GIT, we already told that they have longing for acid things or the sour things. The same symptom we can see in Veretra malpum. And if this feature we see in chronic dyspepsia, then Hepar can be given. And in this one, I have put so many comparative drugs also. So even though according to your syllabus, the comparison that we follow to uh, teach you, uh, there is no comparison between actually Hepar for Veratrum. I started putting this because when you are going towards practice, it is very essential. I mean, I've told you in some class, this was one mistake that I did when I was a BHMS student. I didn't give much importance for this comparison drug because I study Hepar and I see, oh, I have not learned Veratrum, so leave it off. And I left it off. And that left it off became forever left it off. So even now, I have a difficulty to remember these relationships. So, but I had my friend who she was so passionate about materia medica. He's so passionate about materia medica. So even though, suppose today we were taught HEPA self, and I would be someone who would be reading HEPA self in Boric and materia medica, this keynote, sometimes Nash also during my BHMS. Okay, I used to read more drugs only during my MD, to be very frank enough, or to be very honest. Otherwise, BHMS it's so young, we won't be that much serious. So I used to just read these two books and then leave it. And I don't even bother what is being told about paracetamol because that is not a drug that has been taken. But my friend, she used to learn at that time. She'll just turn the pages, she see what is it is saying about paracetamol, even though not taken in class. She won't study it anything, but she will be reading it. What is happening in paracetamol? And towards the end, when we finished our course, her knowledge in materia medica was so immense, because of this comparison studying from that. I mean, I could say the difference which me and she always had is I was not able to connect with this connecting remedies or the comparative remedies because I never tried in the initial stage, but she was always able to. So it is out of from my own experience, I would say you that now when you're learning materia medica, even if you have not learned drugs, because now it's the third or semester that you're learning materia medica, I think. So many drugs you might have learned. So just start learn to this comparative drugs also. So this is a medicine that can be given for marasmus. The child will be having diarrhea, and as already told, there will be sour smelling stool. The child smells sour, and we have a lot of remedies where the child is smelling sour. We have calcarea cup, mec cup, rheum, sanicilla. Even if you have not learned those drugs, just learn. And here you can see this sourness. The sourness, the remedies are carb, calcarea cup, the mec cup, and even in Hepar we are having that that carbonate. I mean, not carbonate, actually, it's a calcium, but still, we can see that um, uh, influence of that carb or the calcium in the GIT, so that they have this sour smelling. So these remedies, all the four, it is indicated when the child is smelling sour. Then there is atony of rectum or paralysis of rectum. So here we see the symptoms similar to alumina, that hepar they have great difficulty to pass stool even if it is very soft and clayey like. This is an exact symptom that we see in alumina. Though I won't say you to remember this symptom as much as that of alumina, because this symptom becomes more important in case of alumina, that the stool, even though it's soft and clay, the person have to exert too much pressure. That's important in alumina. But this atony, which is seen in the rectum of Hepar more than in rectum, in Hepar the atony of bladder is very important, more important. So that is why even if you forget this symptom, atony of rectum, and the related symptom in Hepar I don't bother, but never forget the atony of bladder in Hepar because the urinary features of Hepar is so characteristic. You can see three different situations have been given or explanations have been given how the urinary symptoms will be manifested in Hepar. So micturition is impeded or the flow of urination is impeded. He is obliged to wait a while before the urine passes and then it flows slowly for many days. So the conditions in which there is a UTI, pyelonephritis, etc., where the patient is having this extreme pain. So this is another condition. UTI, if you have ever had this UTI, you would be knowing how intense that pain is while passing the urine or even in the abdomen. So the hypersensitivity, the extreme sensitiveness to pain, what we say, it comes over there also. So here the micturition is impeded and the patient is obliged to wait for a long time before the urine passes. And this is the same symptoms we can see in cystitis. The patient have to wait for a long time and then he feels that is never able to finish urinating. It seems as if some urine is always remaining behind the bladder. Also, the symptoms of cystitis or the inflammation of bladder. There is weakness of the bladder, as we already told, the atony of the bladder or the paralysis of bladder. Then what we see. So these two symptoms, the micturition impeded and never finishing sensation, we can connect it to a UTI, cystitis, pyelonephritis. But this symptom, the coming up symptom, it is very important actually. This symptom is uh, in this symptom, you can see weakness of the bladder. The urine drops vertically down, and he is obliged to wait a while for any passes. Uh, Objectivate we already discussed. The thing is, because of this bladder paralysis or something, the urine usually it should have a I don't know what type of flow we could say that. Anyway, it is not vertically going down. It is having a parabolic. I don't know exactly if it is parabolic, but a type of flow that it is flowing away from the body. Such a flow it is. But here, because there is a bladder weakness, the urine will be flowing vertically down. So that flowing of urine vertically down is a characteristic feature um, of Hepar. It can be also asked as a MCQ. The urine drops vertically down due to paralysis of bladder. So Hepar is the option. There can be escape of prostatic fluid at any time and at stool. Of course, prostate is there is bladder attorney of rectum. So definitely there should be some symptoms affecting the prostate or a pressure symptom or something. So there will be prostatic fluid escape every moment. Though in Hepar it is not very characteristic. I just mentioned it. We have other remedies which have got this characteristic symptom like conium. Um, Beraita, even that has got this symptom. Uh, so not much important in Hepar, but do remember the nature of how the flow of urine is and why that flow of urine is. Then affection of sexual organs occurring in the right side. So in case if we are getting any constitutional patient or constitutional Hepar as a constitutional remedy, and the patient has got some complaints, and there is affections of sexual organs in the right side, we can think about Hepar. Otherwise, Hepar and its right side predilection is not so important. So skin, almost we have discussed it. It's every injury that's separate, that it is even sensitive to touch of cloth. And here, there is a characteristic feature that there are ulcers formed on the body with bloody pus or sour smelling pus or stinking pus or putrid ulcers, where the pus is so offensive in nature. Whatever it is, what they finally meant to say is, however pronouns they use to describe, what they finally mean is that ulcer will be having suppuration or abscess formation, opus formation, and that will be very, very, very offensive with hypersensitive nature. But along with that, what is the next thing that is more important? These ulcers will be surrounded with reddishness. So we can see ulcer or an abscess, and in its periphery, there will be a reddish discoloration. And in that area, there can be pimples also, small, small pimples. It can be 10, 12, or anything. And these small pimples, sometimes it will be remaining, I mean, individually, or most probably they will coalesce together. So what we see will be an ulcer or an abscess with accumulation of pus, and it is surrounded by a area of inflammation, that is reddish area, and over to that there will be some very small pimples, and these small pimples can later coalesce together. Um, so the ulcers spread sometimes by the coagulation of this little pimple. It will be painful, especially at the edge. The pain as if it is so and difficult to heal because it is always inflamed. The pimples always forming and they are coalescing. So it seems that it is not healing properly. And this is a type of ulcer we usually see in case of secondary syphilis. Um, it looks like a lump of lead with a hole in it. Oh, the cancerous ulcers. So this feature of Hepar, this ulcer, its appearance is very important. The ulcer with the laudable pus or the pus that is being accumulated in the center, which is very offensive in nature, that extreme sensitiveness, even the touch of the cloth is unbearable. And then when we see that is towards the periphery of that ulcer, we see an area of congestion or inflammation that is characteristic with red color. So many pimples, and they will be coalescing together, and it is going towards a non-healing ulcer, always in an inflamed stage, and it can be indicated the same feature whichever condition we see, the non-healing ulcers or the cancerous ulcers. And the bend of elbow and popliteal spaces. these areas are specially affected by Hepar sulph. And then LP Foster, he has given this differentiation of Hepar, calcarea sulph, and Cali sulph in their action on tissues. And in the introduction, I told you Hepar sulph and calcarea sulph, which is Schussler's biochem remedy. There are some connections, especially both are able to produce the separative conditions, but there is difference. I told you we'll see later, and here where it comes. So the first remedy, Cali sulph, it acts mainly on the epidermis. And Cali sulph is a very good remedy. We can think in psoriasis, not sorinum, in psoriasis. Cali sulph is a good remedy. I mean, like a specific. Of course, psoriasis is a constitutional complaint, autoimmune disease. We have to go for the uh, mm, constitutional prescription, but Cali sulph is a good remedy because, and its sphere of action is also on the epidermis. But when we go to Hepar sulph is going in deeper layers. It acts on skin, respiratory mucous membrane, and also lymphatic glandular system. And in skin, it will be going much more deeper. And we see in calcarea sulph also, when you learn calcarea sulph, the biochem remedies, it also has got action on all the structures that can produce pus. So it is also having action on glands, skin, and also respiratory, wherever the pus is being formed. So calcarea sulph acts much similar to Hepar, but more deeply. So that is how LP Foster has given Cali sulph more on superficial layer, that is epidermal layer, and Hepar on the glandular system, the skin, and also the respiratory mucous membrane. Similar is the sphere of action of calcareous sulph also, but more deeply. Then for the modalities, in the aggravation, we can see they have a general aggravation in the night, but more so in the early morning hours when blowing the nose. So many modalities are there, but I want you to remember those that is given in color, especially cold in general, that is the dry cold air, from uncovering the head, from surgical injuries, um, then when swallowing, while urinating, because we have seen that they are having cystitis, etc., and aggravation in clear, fine weather or in dry weather. And when I say clear, fine weather, oh, now you can't say me the answer, but there was another remedy having this type of modality, aggravation in clear, fine weather, and uh, amelioration in damp, wet weather, and that was our remedy caustica, if you remember. So even Hepar sulph is having that same modality. And amelioration, because we have uncovering of head to be aggravation, amelioration is from wrapping the head. Cold in general is aggravation, so warmth in general will be amelioration. And clear fine weather is aggravation, so obviously damp wet weather should be amelioration. They have swallowing aggravation, and that swallowing we can connect it to the quinsy or the chronic tonsillitis or even that splinter sensation in the throat. But however, they swallowing is aggravation, but by eating, or rather after eating, the stomach when it is getting full, maybe because of their chronic dyspepsia, they feel very much amelioration. So eating is a amelioration process for them. And relationship, I have told you the relation. It is antidote to mercurial poisoning. Silesia and mercurius are inimical, but Hepar is given as an intermediary. That's why I told you when we say about the inflammation, it comes aconite, belladonna, and Hepar we can give mercurius, silesia, but if we go for the order, it is always mercurius, and in between give Hepar and then give silesia. So I would say actually when I used to prescribe, or if I am prescribing, we'll be going for, you don't have to be always sticking on with this sequence, that aconite, belladonna, then Hepar, Merc, silesia, or Merc salt, Hepar, silesia. Aconite and belladonna, of course, that sequence has to be maintained. When it comes towards the pus formation, we can go for the similarity. Like just because the pus is formed, the three remedies will come up: the mercurius, the Hepar, and also silicea. But silicea will be more towards when it is not the the thing is getting swollen, but it is not getting soft. The pus is getting hardened, remaining in the body. At that time, silicea is given so that it get easily separated. That's why silicea usually is put in the last stage. But what I came to say is that it is not that after aconite and belladonna you give mercurius and then mercurius failed, then you give hepar and then you give silicea. Not like that. It depends on the stage when the patient is coming to you. So if you see that the patient in aconite, to prescribe aconite, it is very difficult. It should be a case that is happening with you or with your family, staying with you. Then only mostly you can prescribe aconite. Otherwise, by the time the patient is coming to you from anywhere out, the aconite stage might have got completed because aconite has to be given in that short gap of the inflammation or the infection that happened. Mostly, most of the cases, by the time the patient reaches to us, aconite stage would have completed. So you need to be very sure that when you are giving aconite, the patient is still in that initial stage itself. Oh, you can go directly to belladonna. And then it is not that you give mercurius and see that. No. But in case the patient is coming to you and more than mercurius, you get the indication of Hepar sulph. You get that hypersensitivity. You get that chill sensation because we don't get that extreme chill sensation in mercurius. Mercurius is like an amphithermal. So mercurius is not this hypersensitive to pain and all. They are more hypersensitive to the change of weather. Any change in weather, mercurius will reflect it. But when it comes to this extreme pain, irritability, we don't get in mercurius. So when a patient is coming to you with a complaint of boil or carbuncle or a furuncle, and you see that the patient is having that fluctuant eruption, not eruption, this boil or pustular condition, and the patient exhibits this extreme pain, chilliness, etc., irritability, you don't have to think like, okay, after aconite and belladonna, I was supposed to use mercurius. No, you don't have to. You can give to Hepar. If the indication is coming, you can give Hepar. But then, after to Hepar, don't give mercurius. After to Hepar, go towards, if it is not working, go towards silicea. That's the only thing that you have to remember here. And in case you didn't get this characteristic feature of Hepar sulph, all this irritability, pain sensitiveness, etc. But this is formed, the pus is formed, and you feel that the patient is having more character towards mercurius, and you prescribe mercurius, it was not acting, then don't go directly to silicea. Give Hepar in between. So that's the only thing that you have to remember. Although there are five medicines, aconite, belladonna, and aconite and belladonna, of course, the sequence matters. But when it comes towards mercurius, Hepar, and silicea, the thing you have to remember is uh, you can give Hepar initially, no need to prescribe mercurius, and then from Hepar, if you feel that the patient needs another remedy, you can go towards silicea. And if you have given mercurius initially, then and mercurius was not acting or partially relieving only, then don't give silicea directly. In between, give Hepar. So this is the thing that you have to remember. Hepar has to be given intermediary between mercurius and silicea. And this is a picture that I copied from Pinterest. Yeah. So it just shows the most important symptoms of Hepar, pictorial representation. And comparisons, these are the comparisons we have to make. So almost all the medicines we have to compare. It's only in the skin we have only Hepar and causticum to be compared. In mind, we have characteristic calcarea carb, calcarea force, causticum, and Hepar, GIT, respiratory. All the medicines will come. Female reproductive system, Hepar is not so important, but other remedies. So this comparisons in short, quickly, we will do in tomorrow's class, okay? And tomorrow's class, now it's for done, for today we have done. Have you taken a screenshot? Let this picture be. Oh no, no, wait. Wait, Farah. Let I put the source also. Have you taken the screenshot? Oh wait. No. Take. Doesn't matter. Okay, so I'll close it because when I'm there, I'm not seeing you, and because you don't speak, I like to come here to see what is happening. So stop sharing, and I'll stop the recording also. But don't go. I have to say you something.